Hi guys, my name is Kayla Long, and today I will be introducing our debate topic as well as introduce our main points and then summarize the illustrations to further help support the argument for the use. Amy Harrison will introduce our counterpoints and summarize illustrations for the counter arguments. Jamie Cundy will be summarizing the main points for the use as well as the current research for that stance. Elizabeth Willman will summarize our counterpoints and the research regarding the counter argument. And at the end of the debate, Lexis Lockhart will pose potential questions for both the point and counterpoint, and then answer the questions through the information provided in our debate and then some research that she found. So today we will be debating on the use of restraints for individuals with autism spectrum disorder and how to best address the use of or the removal of restraint procedures when collaborating with other professionals. So the use of physical restraints and seclusion procedures has been a controversial topic for many years. Restraints can be defined as any physical or defined as any physical method used in order to restrict an individual's freedom of movement, physical activity, or normal use of his or her body. The International Medical Society of Psychiatric and Mental Health Nurses discusses this debate and how ethical the use of restraints are. This has been an ongoing topic in many settings, and a lot of organizations have banned the use of restraints entirely, whereas others have set strict rules on when to implement restraint procedures, but still promote the use in certain situations. So the Professional and Ethical Compliance Codes for Behavior Analysts promotes the use of least restrictive procedures. However, individuals who have been diagnosed with autism or other developmental disabilities can pose high-risk situations for themselves and others around them. Some may engage in severe aggressive behaviors towards others or engage in self-injurious behaviors to themselves. Those who provide services to individuals with severe problem behaviors may need to consider restraints in order to prevent them from severely hurting themselves or others. Restraint and seclusion are used in order to keep the individual safe as well as others in crisis situations, and these interventions are only to be used as a last resort in instances where there are no other options. Restraint procedures are needed in order to keep everyone safe, and like I said, are only used for individuals who display high magnitude behaviors. When restraints are needed, those implementing these procedures are to follow strict guidelines that are often outlined through their company's organization. Many organizations that promote the use of restraint procedures also require strict training and certifications for those who will be implementing these services. These trainings and certifications eliminate the instance of injuring any of the parties involved during these restraint procedures and help to ensure that they will be implemented safely.
An introduction for the counterpoints would be the restraints can have harmful effects on people with disabilities as well as the person who is doing the restraining. So often restraints and seclusions are often misused by professionals in different settings. The restraints can cause not only physical harm, but also mental as well. So physical consequences for the use of restraints include skin trauma, muscle atrophy, limb injury, that includes fracture, skull fracture, intracranial hemorrhage, nerve injury, such as radial nerve and brachial plexus, contractures, and strangulation. Mental consequences from the use of restraints include delirium, agitation, apathy, depression, anxiety, aggression, frustration, disempowerment, cognitive decline, and also PTSD. So, our debate will discuss both sides and dive deeper into the reasons on why physical restraints either should or shouldn't be used.
So, to look more into why they should be used, restraint and seclusion are used in order to keep the learner safe as well as others in crisis situations. These interventions are used as a last resort in instances where there are no other options to keep everyone safe. Learners becoming frustrated or upset within the classroom is a common occurrence due to many factors within the classroom. And in most instances, teachers have the strategies to help de-escalate and assist those students with problem solving the issue. However, when those strategies are no longer effective and a student becomes so upset that they resort to aggression towards others or serious harm to themselves, protocols need to be in place to ensure the safety of everyone involved in the situation. Neuropsychiatrist Daniel Siegel has a book called The Whole Brain Child: 12 Revolutionary Strategies to Nurture Your Child's Developing Mind. In his book, he discusses how children's minds are split into two main parts, what he calls the upstairs and downstairs parts of their brain. And the downstairs brain is responsible for basic functionings like breathing, blinking, impulses, and emotions. This is kind of where the fight or flight comes into play. The upstairs part is responsible for higher order processes like planning, decision making, and self-awareness. So in children, this part of the brain is still developing. Therefore, when a child becomes extremely upset, they may start acting out of the lower part of their brain, where they're not thinking through decisions, problem solving, remaining calm, and sometimes they're past the point of being able to reason with them. In these situations, those de-escalation strategies and antecedent strategies are no longer effective, and so the safety of the individual and others could be at risk. This is why restraint and seclusion as a last resort can be very beneficial. Some children, especially with autism or other developmental disabilities, engage in severe behaviors like biting, headbanging, kicking, hitting, throwing, and all of these behaviors could result in serious injury to that person, other students, or staff. Having the option to use restraint and seclusion ethically when nothing else has been effective can help keep everyone safe in crisis situations. Another point of why use of restraint and seclusion is so important is and why they should be used is because when they are used, they should be used ethically, and protocols are put into place to ensure that everyone in the situation is safe. So as long as they are being used correctly and these protocols are followed, they should be an ethical and safe use. Some of these protocols that should be in place is first the least restrictive options with limited force. So there are a variety of restraint holds that can be utilized, and whichever holds that are selected should be appropriate for the individual based on their health history, past history, strengths, weaknesses, and it should be the least restrictive option for that child. The second important protocol is that any staff member utilizing a restraint or seclusion needs to be highly trained. Training should be given by a professional, and multiple opportunities should be provided to ensure that individuals are implementing all of these techniques safely. Some ways that this can be done is through initial training, but also ongoing training. In addition, supervision or oversight should be given in all situations where restraint or seclusion are used to make sure it's ethical and safe. And the last important component that makes these procedures an ethical strategy is when there's proper documentation, meaning that families are notified as soon as possible and that a debrief follows the restraint or seclusion. And the debrief should be utilized to problem solve strategies to use in the future to avoid having to use more restraint and seclusion, and specific antecedent strategies should be outlined and implemented as soon as possible. With these protocols in place, every instance of a restraint and seclusion should be ethical and safe for the individual and others that are involved.
The first counterpoint is the 2022 Ethical Code for Behavior Analysts, Code .01, providing effective treatment, states that behavior analysts prioritize clients' rights and needs in service delivery. They provide services that are conceptually consistent with behavioral principles based on scientific evidence and designed to maximize desired outcomes and protect all clients, stakeholders, supervisees, trainees, and research participants from harm. By using restraint and seclusion methods, it can potentially cause harm to the client if the restraint methods are done improperly or done by an untrained team member. By using methods that could harm the client would be an ethical code violation. The risk factors of seclusion and restrictive methods posed to an individual are serious injury, death, re-traumatization of people who have a history of trauma, or loss of dignity and other psychological harm. These methods also impede on the person's right and personal choice. One of the foundational principles of the BACB ethical code is to treat others with compassion, dignity, and respect. Not only can the use of seclusion and restrictive methods harm the person that these methods are used against, but also the staff have to implement this, but also the staff that implement the interventions. The summary of the second point is some professionals, such as the medical field, have strict guidelines that regulate restraint and seclusion methods, while other fields, such as schools or child care agencies, have little oversight on the use of restraints and seclusion. There are currently federal laws in place that protect children from restraints and seclusions in hospitals and inpatient facilities. These laws have shown to be effective in decreasing the amount of restraints and seclusions used. They also have allowed for more proper training to occur. As for schools, there are no laws in place. Schools that use restraint and seclusions are also at a higher risk for abuse and misuse of these methods.
So, least restrictive measures are obviously always implemented first. However, some clients may require restraint procedures once all other options have been previously exhausted due to their dangerous behaviors. When a behavior is causing harm to the client or others, safety is the main priority. The dangerous behavior should be decreased first, which may be feasible only through the use of restraints. Not only can these high magnitude behaviors have an impact on an individual's physical health, but they can pose risks for long-term health of the individual, as well as impact their developmental outcomes and quality of life. Restraints can be used to prevent injuries in patients and others, but also can be very beneficial in de-escalating those who are overstimulated and struggle with sensory processing behaviors. So in the following video, we will watch an individual who struggles with sensory processing issues and the self-injurious behaviors he possesses in order to compensate for those sensory processing issues.
French fries, goodwill.
We're not going to In-N-Out either. No In-N-Out. No In-N-Out. No Five Guys. Creed. We're not. It is dark out. Creed. You need to calm down. No. You need to calm down. Well, I'm gonna help you calm down now. I understand that. Okay. We went there earlier, remember? Remember you went to Goodwill? Remember? Remember we went to Five Guys? Earlier today? Remember we went? Free? We went to Five Guys already today. We went there.
So as you can see, this clip provides some insight on some of the behaviors that individuals with autism may engage in, and it portrays some of the self-injurious behaviors that I had mentioned earlier. Self-injurious and aggressive behaviors can cause harm to individuals, but also their families, teachers, therapists, and so on. The Association of Professional Behavior Analysis discusses problem behaviors that are common amongst individuals with mental health or developmental disorders such as autism, and lists self-injurious behavior and aggression being the most prevalent. Self-injurious behaviors such as headbanging, self-biting, body hitting, self-scratching, and dropping are the most commonly reported in those with autism. These behaviors can cause severe injuries to the individuals, including skull fractures, soft tissue injuries, lacerations, scarring, damage to the eye or facial bones, and sometimes even concussions. So, in order to prevent these individuals from serious injuries, restraints can be utilized to help them calm down when they're overstimulated, as well as stop them from harming themselves or others. I would like to reiterate that restraints are only to be used when all other least restrictive measures have been exhausted and the client poses risks to themselves or others. Other less severe behaviors such as mouthing, screaming, or inappropriate urination, for example, do not meet the criteria for restraint and seclusion procedures. So when restraints are necessary, they are to be done in the most ethical way that will benefit the client the most. Organizations that do utilize restraint procedures are to document any time a restraint is used. The parents and guardians are also always to be informed if a restraint procedure is going to be used in a behavior intervention plan, and then will sign off on the BIP prior to implementation. Parents should always be involved in the treatment of their child and how the child is being treated. Restraints can be very beneficial for clients when done ethically and properly. Restraint should only be used as a means to keep the client or others safe and never be used as a punishment procedure. The Professional Crisis Management PCM Association is an organization that provides numerous strategies to prevent the use of unsafe techniques and the misuse of procedures. So the following flowchart that I'm going to put on the screen outlines how to implement restraints and teach staff how to use these restraints in a safe way. So the PCM does a good job at providing the necessary steps to safely implement a professional crisis procedure in order to make sure they are being used ethically and humanely. So let me pull up the picture. So, following picture is a flowchart of the PCMA's organization, prescription, or protocol for implementing PCM procedures. And so they do a really good job on how to train people that will be implementing these procedures, as well as educate instructors, evaluate and certify instructors, apply support, and then make sure that all of these are safe and effective throughout the time that they're being used. So PCM is defined as, or PCM is a defined and structured program that includes training and in-servicing requirements, data collection and monitoring, and ongoing review and oversight. So an article by Winston states that crisis management systems should not be viewed as a replacement for appropriate behavioral treatment, but as a safety measure when all else fails. So they are appropriate when behavioral interventions are not effective in averting an escalation of problem behavior that reaches crisis levels. This organization clearly outlines when crisis procedures are to be used and what restraints are necessary based on the severity level of the behavior. So the PCMA values the dignity of clients and clearly defines how to use humane procedures to help decrease severe problem behaviors.
Right. So there are alternative methods to physical restraints and seclusions. Physical restraints and seclusion can cause serious injuries to the individual being secluded. So, for example, you can use blocking pads or hide behind a door if the client is being aggressive. So, I'm going to show you an example. This is an example of a blocking pad you could use to protect yourself. And if the client is engaging in self-injurious behaviors, you can block the behavior or use redirection as necessary. Also, if the client is engaging in property destruction, you can make sure the client and other staff are safe and try to block behavior and use redirection as well for this behavior. Another illustration is the Sunland Miami scandal. I'll pull up a picture for this one as well. This took place in 1972 in a regional center in Florida. Sunland Miami was a training center for developmentally disabled individuals with no guidelines and no restrictions. This was a scandal which involved public humiliation, beatings, 2-day-long punishments, repulsive consequences, and there was no way for residents to express grievances.
So when looking at the research that supports the use of these, there really isn't a whole lot of research that supports the use of them. But that's because of the intrusiveness of the methods. And most people would agree that they should not be used as the first option to manage problem behavior. There's evidence of other antecedent strategies that can be utilized to address those. However, as we've kind of stated throughout this presentation, is that there are instances where those antecedent strategies are not effective. And there have been acknowledgments in research that while restraint and seclusion should never be used first, it should be always the last resort, it can be beneficial in crisis situations. In an article by Trader and colleagues in 2017, they discussed how restraint and seclusion have in the past been used excessively in schools, and they state that this overuse is due to an absence in the investment in planning, training, coaching, and organization of administrative supports needed to educate students with diverse needs. So it's critical that administration takes the time to train more specifically on these pre-antecedent de-escalation strategies available to avoid the use of restraint and seclusion, but also to provide the protocols appropriate for safe and ethical use of restraint and seclusion in crisis situations. Similarly, Roy and his colleagues in 2019 outlined reasons in which restraint and seclusion have typically been used in the past in residential settings. Some of the reasons they said were to prevent a child who was escalated from harming themselves, to prevent a child from harming others, including staff or other patients, to prevent a child from damaging property, or to use when other less restrictive methods have been proven ineffective. They recognize in this article that the goal should always be to utilize restraint and seclusion less, but also recognize that there are emergency situations when these methods are necessary. The Association for Behavior Analysis International created a position statement regarding the use of restraint and seclusion. Overall, they oppose the inappropriate and unnecessary use of restraint and seclusion, but once again, they did acknowledge that there are rare occasions where these methods are necessary with meticulous clinical oversight and control. They also stated that careful planned and monitored use of timeout from reinforcement can be acceptable under restricted circumstances. In addition, there are also times when seclusion is necessary in which behavior analysts should support only the most highly monitored and ethical practices associated with such use. So a central part of all of this research is that in order for procedures like restraint and seclusion to be used effectively and ethically, it requires the collaboration of all professionals on the child's team, as well as the implementation of the protocols I discussed earlier, like training, documentation, and least restrictive measures to make sure that these techniques are used safely and ethically.
To summarize the research for the counterpoints is the use of restraint and seclusion methods should never be used for the purposes of discipline, coercion, or staff convenience, or as a replacement for inadequate levels of staffing. The use of restraints can cause the most serious physical health risks to the person who is being restrained. A study that was done on the use of emergency restraints found that about 1 in 3 emergency restraints resulted in an injury. In some cases, research has found that seclusion and restrictive interventions can potentially worsen the problem behavior and decrease the effectiveness of the interventions. The use of seclusion and other restrictive methods may stop a behavior short term, but if the function or the cause of the behavior is not addressed by the organization, the use of these methods are more likely to be used again. Walker and Pinkelman explained that staff at a school who used restrictions and seclusion interventions may enter into a behavior trap due to the fact that these interventions can cause the problem behavior to decrease immediately in the moment. This may reinforce the staff and cause the school staff to abandon interventions that are listed in the child's IEP or behavior support plan. The federal government is currently trying to get involved into schools to help improve restraint and seclusion methods to make it more safe for them, since there is such an overwhelming amount of restraint and seclusion issues within the school system. Research has also shown that the use of evidence-based practices can help address severe problem behaviors amongst individuals with intellectual or developmental disabilities in various settings, such as schools.
So some of the potential questions that can come from the topic of our debate include what can possibly happen in the case of a parent or guardian specifically asking for restraints and holds not to be used? And is there any other way to handle these situations? So as mentioned before, all parents are required to be on board with using restraints and holds when it comes to their children. And if a parent were to request that these methods not be used, then staff would be encouraged to find another method, such as blocking, redirecting, or planned ignoring. Another potential question that goes for their use would be, should all personnel that are or may be required to use restraints and holds undergo extensive training before performing them? And as mentioned earlier in our debate, it is required for personnel to be extensively trained and in most cases supervised when they're using restraints, just to ensure safety of the children and themselves, and all other staff that may be involved in any situations. And to some questions that may be brought up for against the use would be, what are some of the things or situations that make the use of restraints and holds considered inappropriate? And according to Walker and Pinkelman, some staff may use these restraints and hold procedures in an improper way, or sometimes they may even be abused and used when not absolutely necessary. There's also research that says that using the restraints and holds more often can kind of create like a neglect for evidence-based practices. So more companies will kind of sway towards using restraints and holds instead of using evidence-based practices, such as those that are used in like ABA services and so on and so forth. Another question would be, if all personnel that may be required to use restraints and holds were trained extensively, would it make them more acceptable? Trader et al. Says that possibly, but not in every situation, staff still have the potential to abuse the strategy or to use it in the wrong situation, as I mentioned in the question earlier. And some other questions that were brought up in regards to collaborating with other professionals were, how can behavior analysts help ensure that they are collaborating with other professionals in an ethical manner? In this case, one of the most important ways would be to ensure that they are familiar with the BACB's ethical guidelines, and that they are following them. It's also important to make sure that they are following company policies, because in most cases, companies line their policies up with these kind of ethical guidelines.
To piggyback off of Lexus, I also think that like documentation of the collaboration with other professionals is also a part of being ethical. Compromising is listed in the ethical code as well, and just making sure that well-documented notes are being taken of these instances of disagreement or compromise.
Another question that may be brought up in regards to collaborating with other professionals is, do you have any personal experiences related to this topic that you would like to share?
So I personally have had some experience with this topic. I have worked in situations where restraints and holds have proven to be very beneficial through the use of keeping records every time it was used, being not watched, but being reviewed every time they were used. So never being in alone when using restraints and seclusion procedures. When the restraints and seclusions were very detailed and outlined and we were properly trained prior to using them, I have seen them be very beneficial. However, I have also seen them be kind of a negative thing in regards to some people wanting to use improper restraints or improper holds when either they weren't certified or they didn't have the knowledge of using those restraints in that situation. And it didn't put the client at the time in any harm, but it could have been a very harmful situation potentially if they had hurt them or it had gotten more severe.
I also have experience with this topic, and in my experience, I've actually been injured because of a student, and in that situation, it was nice to have that last resort option of a restraint or seclusion in order to keep, at that point I had already been hurt, so then my staff could then be safe as well after the incident, which was nice, and we could also protect the students in this situation. So having that last layer of safety was really comforting in the classroom, to just know that I could protect the other students. But I think it also highlights the importance of really evaluating the behaviors of your students and looking at the function of them and being proactive as far as, doing an FBA, functional analysis, to really look at why the behaviors are happening, to get on the front end of it, so you're not having to use reactive strategies and more so using proactive strategies. And it also emphasizes the whole topic of this debate is how it's so important to collaborate with other professionals and work together so that situations don't get to the point of needing restraint and seclusion, because they are very intrusive and it's not great. And even as a last resort, it's still not something you want to use, but in the end, it's to keep everyone safe. So I definitely see both sides of the argument.
I also have some personal experiences that relate to the topic. I have not used seclusion or restraints, but I have used blocking pads and redirections to avoid restraints and seclusion in a clinical setting, and it was to keep clients and the staff safe, and it was very successful. Like, for example, if the client was engaging in self-injurious behaviors, we would redirect or give them a sensory item, and this was very successful. Not saying this would always work, but it was something that was successful in the situation.
Okay, and this concludes our debate presentation on the use of restraints and holds, and thank you all for watching.